There is an atmosphere of fear, and that fear is going into psychosis, and that is because of some study has been published in a Springer Nature magazine, which is done by Banaras Hindu University, and that study shows that out of 927 subjects, there were 4 deaths. But if we analyze, there are 3 most important things. Number one, there is no comparison study. That 927 people were given vaccine and what happened to them, and 927 people were not given the vaccine, what happened to them. This comparison is not there. So it is possible that those who have not taken vaccine, there could have been more adverse effects and more deaths. Number two, out of 4 deaths, all the 4 people who had death, they had diabetes. 3 had hypertension, 2 had stroke, and one lady, she had some unknown circumstances. She used to get unconsciousness. Cause of death was not established. That means everybody who died had 1 or 2 or 3, that is multiple comorbidity. So, and one of them had a mucormycosis, which was a very severe fungal infection that is described as a black fungus. So, under these circumstances, we cannot establish that this death has been because of COVID vaccine. Now, the second issue is that this is published in a journal which is called Springer Nature, and the impact factor of that journal is only 1.5, which is not very much impactful journal. And this journal is owned by a British-German company. And if you remember, the Covishield vaccine or the AstraZeneca vaccine is owned and manufactured by a British-German company. So they just maybe wanted to show that none of the vaccine is safe. Not only Covishield, even other vaccines are like that. Number 3, whatever adverse effects are seen, there are adverse effects of importance. They are, again you need to see whether they had comorbidities, diabetes, etc. and what kind of things have been happening in them, whether it is because of COVID or long COVID or because of vaccine. So at this stage, I would like to appeal people that don't worry, COVID has been long over. COVID vaccine has been taken by us by 2 or 3 years before. Now those effects are not going to come. Whatever effects or adverse effects were supposed to come, they were between 2 to 3 months after taking the vaccine. So just be relaxed. All such publications will keep on coming, and they have always some or the other bias.